An estimated 11 million Americans have AMD, and numbers are growing. Lifestyle changes that are recommended to reduce your risk of this disease include physical activity, quitting smoking or not starting, and eating a healthy diet to maintain healthy cholesterol and blood pressure levels. Methods of diagnosing AMD include optical coherence tomography, which is typically used to detect dry AMD, and fluorescence angiography, which is an effective way of detecting wet AMD. Risk factors include aging, with most people starting to show signs around age 55, having a family history of AMD, being Caucasian, smoking, and having high blood pressure and cardiovascular disease. There are two types of age-related macular degeneration, dry and wet. The majority of people have dry or atrophic age-related macular degeneration, which is caused by the thinning of the macula as you age. Wet or neovascular AMD is less common and is caused by the growth of abnormal blood vessels in the eye that damage the macula. There are also different stages of this disease, including early, intermediate, and late. While dry AMD can happen in all three stages, wet AMD occurs in the late stage. Age-related macular degeneration originates from uncleared cellular debris in the retinal pigment epithelium. When this builds, drusen forms, which are white or yellow deposits on the macula and mainly consist of lipids. When drusen deposits on what is called the Bruch's membrane occurs with biochemical changes, such as continuous activation of the complement cascade and inflammation, can lead to thickening of the membrane. The complement cascade is a biochemical process that helps the immune system clear pathogens from the body. When this membrane thickens, nutrient transport to the retina and waste exchange to the choroid, which is a vascular layer between the retina and sclera, are obstructed. This obstruction then leads to thinning of the choroidal vasculature. And finally, all of these factors, along with neurodegenerative changes of the photoreceptor retinal pigment epithelium, results in abnormalities in pigment which are seen in early or intermediate age-related macular degeneration. There are two popular natural therapies for AMD we're going to talk about, and they include carotenoids and omega-3 fatty acids. First, we're going to talk about carotenoids, which are a micronutrient that are orange, yellow, and red fat-soluble pigments. Food sources of carotenoids include carrots, sweet potatoes, pumpkins, tomatoes, and oranges. When consumed, carotenoids are taken into the macula in the eye, where they absorb blue light and maintain visual function, and they act as antioxidants by protecting cells against free radicals. We will look at three studies on carotenoid supplementation. The first study is on sustained supplementation and monitored response with differing carotenoid formulations in early age-related macular degeneration. This study was conducted in Waterford, Ireland, and consisted of a single-blind, randomized controlled clinical trial with 47 participants. Each participant was divided into one of three groups that were given different dosages of various carotenoid supplements, including lutein, zeaxanthin, and mesozeaxanthin. Through the 36-month intervention period, each participant attended follow-up meetings to monitor macular pigment, visual acuity, and AMD status. The results of this study found significant improvements in macular pigment in all groups, except for the group 1 between months 24 and 36. The limitations of this study are that the study design is only single-blind instead of double-blind, and that there were no placebo groups included. The second study is on serum and macular responses to multiple xanthophyll supplements in patients with early age-related macular degeneration. This study is a double-blind, randomized, placebo-controlled trial conducted in Beijing, China. There were 108 participants with early AMD that were over the age of 50, with 42 men and 62 women. The age range was between 50 and 81 years. Participants were divided into 4 groups, each with 27 participants that were given various doses for the 48-week intervention period. Group 1 received a low dose of lutein. Group 2 received a high dose of lutein. Group 3 received a low dose of both lutein and zeaxanthin, and Group 4 received a placebo supplement. Throughout the intervention period, fasting blood samples were taken periodically, and autofluorescence images and fundus photographs were taken at baseline, at 24 weeks, and at 48 weeks. The results found significant increases in serum lutein levels in all non-placebo groups and significant increases in macular pigment optical density in the high lutein group at 24 weeks and in the high lutein and zeaxanthin groups at 48 weeks. A limitation of this study is that it was the first randomized clinical trial that measured the effects of lutein and zeaxanthin on macular pigment optical density and serum levels in Asia. The third study is on serum response to supplemental macular carotenoids in subjects with and without age-related macular degeneration. This study was also conducted in Waterford, Ireland, and consisted of a double-blind, randomized study design. A total of 54 subjects participated in the study, with 27 with and 27 without AMD. Each participant was divided into 3 groups and were required to take 1 capsule containing the given dosages daily during the main meal throughout the 8-week intervention. Group 1 received 20 milligrams of lutein and 2 milligrams of zeaxanthin. Group 2 received 10 milligrams of lutein and 2 milligrams of zeaxanthin and 10 milligrams of mesozeaxanthin. And Group 3 received 3 milligrams of lutein, 2 milligrams of zeaxanthin, and 17 milligrams of mesozeaxanthin. The results of this study found significant increases in serum zeaxanthin levels in groups 1 and 2, but no differences between subjects with and without AMD, and significant increases in serum mesozeaxanthin levels for subjects with AMD in group 3. This study concludes that subjects with AMD are comparable to normal subjects with their response to macular carotenoid supplements. However, the significant increase in mesozeaxanthin levels in AMD subjects in group 3 supports evidence of increased absorption of carotenoids by the macula. And limitations of this study are the lack of a placebo group and having a small sample size. Next, I'm going to talk about omega-3 fatty acids, which are essential fats, meaning you can only get them from food. They also have anti-inflammatory effects and protect heart health. Food sources of omega-3 fatty acids include fish, plant oils, and nuts and seeds. This first study is on a dietary omega-3 long-chain polyunsaturated fatty acid intake and 12-year incidence of neovascular age-related macular degeneration and central geographic atrophy. This study is a prospective cohort study of the age-related eye disease study, or ARIDS, and was conducted on 1,837 participants from 11 different clinical sites in the U.S. Each subject had a moderate to high risk of AMD and a visual acuity of 20/32 or better. The data for this study was collected through a food frequency questionnaire of omega-3 intake and fundus photography over the course of a 12-year intervention period. A limitation of this study is that the observational design did not allow researchers to rule out factors that were not measured, such as physical activity and metabolic rate. The second study is a prospective cohort study on 38,022 women, with a mean age of 54 who were not diagnosed with age-related macular degeneration. Throughout the 10 years of follow-ups, data was collected at baseline through a food frequency questionnaire and annual questionnaires that assessed compliance of taking pills and notable events such as being diagnosed with AMD and the results found a total of 235 participants were diagnosed with AMD after 10 years, and participants who consumed the lowest amounts of EPA and DHA had a higher risk of developing AMD than those who consumed the highest amounts, and participants that consumed less than 1 serving of fish per week had a higher risk of developing AMD than those who consumed 1 or more servings of fish per week. And the limitations of this study include the prospective design preventing researchers from ruling out recall bias. This third study is on the circulating omega-3 fatty acids and neovascular age-related macular degeneration. This study was conducted in France using a case-controlled study design, and there were a total of 434 participants, with 290 having neovascular AMD in one eye and early AMD in the other eye, and 144 control participants. Over the course of a year, data was collected through a validated food frequency questionnaire, and the results of this study found that participants with AMD had a significantly lower consumption of oily fish and seafood than control subjects, and that EPA and DHA as biomarkers of dietary omega-3 fatty acid status was associated with neurovascular AMD. Limitations of this study include a recall bias from using a case-controlled study design and the use of a food frequency questionnaire, which can cause inaccuracies in data. In summary, we can conclude that both carotenoids and omega-3 fatty acids are effective natural therapies in reducing risk of AMD, and none of the studies reported having adverse side effects. However, that does not mean that there is no potential for side effects. The concerns for carotenoids are that 2 of the studies had no control groups, and all 3 of the studies had small sample sizes. Concerns of the omega-3 fatty acid studies are the use of prospective cohort study designs and possible inaccurate food recall and food frequency questionnaires, which may cause errors in study results. Therefore, my recommendations are to first consume these micronutrients through the diet before considering supplementation, consulting a physician before starting any of these supplements, and to be aware of any possible interactions with prescription drugs. Other mind-body practices used to prevent AMD include Tritaka Yoga, which is a type of meditation, along with avoiding long periods of screen time and getting proper sleep. And here are all of my references.